Hello, welcome to another whiteboard learning. Today is about heat stroke, and the reason is it's very timely right now. It's about time that we see them, and we'll go over that as for why. So let's talk about heat stroke. So we talked about fever before, the causes of true fever, but we really didn't talk about just a little bit about hyperthermia versus true fever. So you remember in true fever, you have a signal that says there's some inflammatory problem and we want to increase the temperature of the body on purpose. So we will increase the set point. So if the thermometer says usually the dog wants to be 100, now the dog wants to be 104. And the increase of temperature is done by a few things, by vasoconstriction. So you don't have blood going to the periphery of your hands, and so that you keep your heat to the center of the body. You'll also seek heat, like seek a hot place to sit in the sun, go under the covers, things like that. And you'll also have chemicals in your body that basically are released to increase your metabolism. So that's like thyroid hormone and catecholamines and stuff like that. So you increase the temperature and you try to not dissipate, but that's not really the heat. That's not really the main mechanism. You're increasing the temperature. So the main mechanism there is that you want to be hotter. Now, hyperthermia is when you're accidentally hotter because of something you've done or somewhere you are. So you do have more heat, but you can't increase dissipation. And that's loss. So when you want to lose heat, what do? You will pant if you're a dog, so that you can have evaporation of hot water, and so that cools you off. You might get wet, so you seek cool or wet. You're going to vasodilate the periphery. You'll send more blood to your hand, keep it away from your core where it's hot, it's your muscles and your feet, and that way it can also evaporate off your skin. So you'll radiate heat and you'll evaporate heat off of your skin. So those are all things with sweat as well, if you can sweat. Remember, dogs can't really sweat. So there's lots of things that will happen, but if this overwhelms your ability to lose it, that's when you'll get hot from hyperthermia. And that's different than changing your set point. The set point here is still the same, normal 100 degrees. So let's think about some situations which are hyperthermia. So one would be exercise. So I exercise and I normally get a little warm, but I do things to help myself dissipate that. On a regular day, I can pant, I can do stuff, and I'll be fine. But if you exercise on a hotter than normal day for what you're used to, or a more humid day, and humid means there's water particles right in the air. So if it's humid and you're trying to give off air, that's very hard because the air is already saturated with water, and you're trying to give off water to help you give off heat, so it doesn't work. So if you exercise in these conditions, you're going to have a hard time dissipating, right? So that's what we're talking about. Exercise can do this. And sometimes we'll see, especially dogs at risk, which we'll talk about, that have trouble with this. Cats are smart. They don't do this unless they're made to. So what is the other way you can get hyperthermia is environmental. So that would be that you're locked in a hot car or a hot room, or some other situation where you can't get away from it. You can't seek a cool place. And that's the other way, is that your body didn't do it, but you had to take on the heat because of the environment. Now, certain dogs are more at risk, and those would be older, for metabolic reasons, and obese, and those with some sort of respiratory disease already. And the big ones that tend to come to mind are the brachycephalics dogs, and we'll talk about what that means. So this is your normal nose of a dog. Remember, I'm just the best artist ever. So that's like your German Shepherd, your Collie. They have a long nose, right? That's a dolichocephalic, meaning a long-faced dog. Brachycephalic is your pug. So I'm going to draw, oh my gosh, I don't even know that I can draw a pug. It looks like a human. So here's your pug with its funny nose. And that looks like it has a face and its ear. And there is no nose. So the cooling that happens in the nose can't happen with these guys. Plus, they have other issues. So I should have drawn him over here. So if he's here and he or she is trying to breathe, let's get rid of that. The problems that come with brachycephalic are that they have a narrow windpipe. So it's harder to get air in and out. And they have stenotic nares, meaning that the nares are more narrow than normal, the nose holes. They have an elongated soft palate. So if here's their teeth on the top coming out, that's the hard palate where there's a bone. And then after that is a little piece of dangly mucosa in the back of the roof of the mouth, and that is, and here's the bottom teeth, that is the soft palate. So their soft palate hits their vocal folds, their larynx, and so it creates a flap. And if it gets in the way of breathing, it can get inflamed and swollen. And then on their arytenoids, they have everted saccules. And these are little sacs on the vocal cords that get stuck out, and then they get in the way of breathing. So brachycephalic dogs have all these other respiratory issues, which we know, but when it turns hot, they have a hard time dissipating heat. So brachycephalics. And then another case that this would happen, we just saw this, was a dog with laryngeal paralysis, where the vocal folds don't get out of the way because they're paralyzed. That would be another one. Collapsing trachea dogs can be triggered by heat. Certainly feline asthma can get exacerbated by heat, but that's not usually leading to heat stroke, right? So that just leads to a respiratory distress. And then I'm going to put on here for this sort of problem, the lab, right? The lab with the ball cannot stop, right? So you got to be careful with these guys because they will not stop even if they are having trouble. So that's the main risk factors that what happens here. But why are we worried about it mostly now? Well, this is the time period where we can have sudden bursts of fantastic weather, just like we just had, and we are not acclimated. So that's you and me too. So we have to be used to the temperature that it is. And what that chemically means is that we're better at dissipating the heat, at getting rid of it. We build up chemicals called pyrogens, or heat protective chemicals, heat proteins. We are better at having a chemically stable cell. So, because the big thing, right, with heat is if you're too hot, your cells actually, the proteins in them come apart. Instead of being nicely folded into some really helpful shape, they will fall apart. But there are chemicals that get in there, shock proteins, heat proteins that come in there, and they'll stabilize the protein for longer. But you got to know to make those, and you got to get used to it by being around the heat for a little bit gradually. And so that's what acclimatization will do for you. You'll also be able to sweat better, which doesn't necessarily help our dogs, but helps us. And then you'll also get better at putting blood into good organs to protect, like the kidneys and the brain. Your cardiac output is put in better places. I can kind of simplify it like that. So let's say here it is April and you suddenly have a nice heat wave and everybody goes outside and starts to do a lot of stuff. This is when is the most common time to see heat stroke in people and in animals and dogs. So What happens to you in heat stroke? Well, if your proteins don't work in your body, your cellular function everywhere is going to break down. Heat stroke is the worst phase of cramps, heat cramps. That's the first thing that happens. And then you get heat exhaustion. And that is the same as prostration. You'll hear heat prostration. That's a human term. But these, obviously your muscles are starting to have trouble. Here, you're starting to feel weak. You're having vomiting and diarrhea. But then you get to heat stroke. And heat stroke is when these proteins in your organs that are sensitive, and that would be your brain, because one of the hallmarks of heat stroke is being dull, even maybe having seizures. And your gut, you start to get hemorrhagic diarrhea. You start to have your kidneys get injured because they're not getting enough blood flow. You start to have trouble with arrhythmias. And you have trouble with your clotting system. So one of the most fragile systems is your clotting system. And you'll start to go into disseminated intravascular coagulopathy, or DIC. And what does this all represent? All these organs? Multiple organ dysfunction or failure is a term you may have heard of. So those are all the kind of acronyms we throw around, but basically it means you're more susceptible to strokes and bleeding. That's what happens. That's what's weird about DIC, is that your clotting system is just all over the place, and your organs can shut down. You have to get to them pretty fast and resuscitate them with fluids, and you also have to cool them. So it is, if you've worked with me for a long time, I am not a fan of ice, and I am not a fan of cool IV fluids. I'm a fan of room temperature. So when I say cool, that means relative. I need you just to be less hot, but the way that we found is best to cool these guys down is you don't want to do it too abruptly, and that's what ice does. Plus, if you put ice on your skin, it's going to vasoconstrict, and that's exactly opposite of what we want to do. We want them to vasodilate so they can lose heat better. So what we generally do is room temperature water on the patient and then get a fan. And that does two things. This wetting them is part to help with the direct contact of a cooler substance, right? Room temperature water is 60 degrees. And they might be 109, right? So that's enough of a difference to help them cool down. And plus the fan helps them evaporate. And so there really doesn't need to be anything more than these guys. And then if you get them down to about 103, 104, stop actively cooling them, because you don't want them to dip lower. There was a study that said they did poorly if they went low and then rebounded up, stuff like that. So that's a general introduction to heat stroke and the patients that are more likely to have trouble with it. And why we get so worried about them is because they can really fall down the rabbit hole pretty quickly. I hope that helps, and ask me any questions if you have them.